Urinary incontinence is the involuntary loss of urine, and it can range from a few drops and complete loss of the bladder control. Is the often embarrassing, but is this more common than you think, and unfortunately it is treatable. Type of incontinence. Stress is incontinence. It occurs when doing activities that increase abdominal pressures, such as couching, loading, and exercise. Urgent incontinence. A sudden and intense feeling to urinate, followed by an involuntary loss. Mixed incontinence. A combination of the two previous types. Overflow incontinence, and the bladder comes overfilling and leaks constantly. Causes: age, more common in older adults, pregnancy and childbirth, the weakening of the pelvic floor muscles, obesity, extra pressure of bladder, disease, diabetes, neurological disease, etc. Medication. Some medication can use incontinence. Symptoms: involuntary of the urinate, frequency need to urinate, difficulty starting or stop the flow urinate, and feeling like you are not emptying your bladder completely. Options. There are many treatment options, which will depend too of the type, incontinent, and use case. Some include lifestyle change with contract pelvic floor exercise, diet adjustment, and fluids. 2. Medications to help to the control bladder contractions. 3. Medical devices such as vaginal paresis. And 4. And the last one, surgery in the more severe case. The article highlights the importance to supervise basic pelvic floor exercise, the treating stress urinary incontinence in women. In the public health issues affects 200 million people worldwide, and their exercise have proved effective in the improving quality of the life, reducing episodes of the urinary leakage. The importance of the article. The clinical relevance in the classes that supervision and the psychotherapy significantly improve outcomes compared on the upper-safe exercise. Supervised patients and exercise rate reduction in urinary language and better quality of life. 2. The scientific validation. The study was designed as the reference the control trial supporting in the valid of the result. And number 3, promotion and the physiotherapy role. In the demonstrates the value and the physiotherapy intervention in the conservative manages of a common conditional potentiality avoiding sources in the invasive treatment. Role in the physiotherapy in the condition. Number 1. Pelvic floor exercise. Specific exercise such as the controlled contraction in the left and muscle, stretching the muscle fibers and responsibility for urinary control. Number 2. The professional supervision. Guidance from a physiotherapy ensuring parents and perform exercise correctly, aging treatment effective. Number 3. The cost and the risk reduction is a non-invasive therapy is a reduce the net surgical producers and the potential complication. Number 4. Quality in the of life important. Uh, Supervise the parents report high satisfaction and the less need for additional treatment as evidenced by study. In summary, in the article underscores the positive impact of physiotherapy in the Swiss, especially when the conducts in supervision, and reinforce the importance of professional intervention to optimize results.
Kegel exercises are a simple and effective way to strengthen the pelvic floor muscles. To perform them, start by finding a comfortable position, whether sitting, laying down, or standing, and relax the muscles of your abdomen and thighs. The first step is identifying the correct muscles. Imagine trying to stop the flow of urine midstream. This helps you locate your pelvic floor muscles, but avoid doing it frequently to prevent any negative effects. Once you've identified the right muscles, contract them for 5 seconds while breathing normally, then completely relax for another 5 seconds and repeat the cycle 10 to 15 times per session. Do this for 3 sessions per day to achieve the best results. These exercises are highly beneficial for strengthening the pelvic diaphragm, improving the support of internal organs like the bladder, uterus, and rectum. They are effective treating and preventing urinary incontinence, enhancing sexual function for both men and women, and restoring muscle tone after vaginal childbirth. The main muscles targeted include the pubococcygeus, ilococcygeus, and coccygeus, along with the urethral and anal sphincters, which are essential for urinary and fecal continency. It's crucial to avoid engaging incorrect muscles such as the abdomen, buttocks, or thighs during the exercise. If you are unsure about performing them correctly, consult a specialized physical therapist. Consistency is key. Results typically appear after several weeks of regular practice. These exercises were introduced in 1948 by Dr. Arnold Cahill as a non-surgical alternative to address urinary incontinence in postpartum women. Today, they are recommended for conditions like urinary or fecal incontinence, mild pelvic organ prolapse, improved sexual function, and rehabilitation following childbirth or gynecology surgeries. However, they should not be performed if you have active urinary infections, undiagnosed chronic pelvic pain, pelvic floor hypertonia, or muscle spasms in the pelvic area. With patience and regular practice, Kegel exercises can become a valuable tool for enhancing pelvic health and improving quality of life at various stages of life.
Horse panties with be light tuned and supine. Bending the skin's foot solids and the floor, let's separate heated width apart. Contracted pelvic floor and raises your pelvis, activate your glutes. Until your heels are in line with your shoulders and knees. Hold this posture for complete and seconds. Breathe during the exercise. Raise your pelvis, hold and relax, and you raise your pelvis. Breathe and your lower in's relative breath. Cats are leaned under the seat, hats and leans with the shoulder, but sided supporting the toes. Activate the pelvis floor, the work which raises the cleans light, separating the from the floor. Will hold for 1, 2, 5 seconds until lower the kins. Making sure not to lose the content of the pelvic floor until touches the floor, brave feet through good mobility. This would be done for 2 to 5 this with I with. Bye. Thank you.